Hello and welcome to the special broadcast, Mental Health Matters. I'm Chaiti Narula. The isolation and economic hardship related to coronavirus pandemic and the lockdown is creating a mental health crisis around the world and in India as well. Several research reports warn that this could make the already rising suicide rates worse. If you see the numbers during any financial crisis or any pandemic for that matter, most mental health issues are linked to economic hardships. But there is a solution to this, and our experts today hit. But first up, let's understand the problem at hand. Here's a look. The grief, the isolation, the loneliness, all creating a mental health crisis. The world is now perhaps bracing itself for a wave of mental health pandemic. If one goes through the history of pandemics, an inevitable economic downturn follows. The Suicide Prevention India Foundation estimates that India is now staring at a mental health crisis, with suicide rates being the lead indicator.
There has been an enormous burden on mental health with this virus because you have people who are dying alone. You have people who are becoming depressed.
करीब 5 करोड़ लोगों तक मैं पहुंचा और मेरे ध्यान में आया कि निगेटिविटी है, नर्वसनेस है, फ्रस्ट्रेशन है. कुछ लोग तो बोल रहे हैं हम सुसाइड करें, यहाँ ऐसी बातें करने लगे थे. तो पॉजिटिविटी एंड सेल्फ कॉन्फिडेंस और हम जीतेंगे इस प्रकार का आत्मविश्वास जगाना ये सबसे आवश्यक था.
Few days ago we got a case of a minor who attempted suicide. She engaged in self-harm behavior and her school counselor got in touch with me. The mother, being reluctant, did not act firmly. Hence, the counselor got in touch with the childline helpline. That day, using QPR techniques and getting in touch with some of the helplines, we saved a life.
The Wellbeing Trust and researchers affiliated with American Academy released a study recently that predicted that over the next 10 years, as many as 75,000 additional people may die from deaths of despair as a result of the coronavirus pandemic. The lethal combination of economic uncertainty and social isolation is here to stay, and that is a cause of serious worry. Society today is witnessing cancelled events, businesses shutting shop. With schools shutting down for long hauls, some parents are even forced to take time off work. The markets across the world are showing drops, market caps being wiped off. A New York Times article provocatively titled, "How Austerity Kills," Stuckler and Stanford professor Sanjay Basu pointed out that suicide rates were significantly greater in states where most people lost their jobs.
The price that we were paying was not just the financial toll. There is already a hunger crisis, fear and panic is everywhere. And as more and more people are unable to feed their families, unfortunately, we are also expecting an increase in the suicide rates. Apart from this, with strict lockdown and social distancing measures in place, there is a forced isolation. Social isolation, or loneliness as we know it, is associated with mental and physical health consequences.
Experts feel policy intervention and short-term solutions to sustain people financially is now the need of the hour. In New Delhi, Chaiti Narula for India Today. Some of the biggest names from the field of mental health are now joining us. Dr. Samir Parikh joins us. He's a psychiatrist. Dr. Jayjit Bhattacharya, renowned economist, is now joining us. And Dr. Samir Malhotra, who's a psychiatrist, also joins us today. But first up, let's go over to a lady who's joining us. She recently lost her father due to suicide in the lockdown. I'm going to come to you first to ask you what really happened there, and could it have been prevented?
I was overseas when this happened to my dad. My dad just went back, and that's when lockdown started. And the whole thing hit him really hard. Firstly, because of loneliness and nobody could come and see them. He began to feel that people were considering him as someone to stay away from. The news worried him as well. And also he couldn't do the stuff that he used to do on a daily basis. And he began to feel a sense of worthlessness. We did hear signs of depression, but didn't know that it was that serious, and wish we had recognized the signs and understood that the outcomes of this were this serious. And definitely a bit more understanding of the severity of what it was would have allowed us to help him more.
So when he was showing these signs of depression and worthlessness as well, was there any psychiatric intervention or a mental health expert intervening into the matter? Was it flagged off? What really happened there? Or did it go undetected and the lockdown added to the worry, and that's when he was pushed to the edge and took the final plunge?
Firstly, Dad was worried to leave the house as well because he felt that he will be exposing himself to the virus by going out. My mother being alone and not having much help, didn't know what exactly to do. We were trying to do our best by talking to him from overseas and trying to get some help. But at that point, we didn't understand that it was that severe. And having a bit more knowledge on the words he was saying and the feelings that he was going through would have allowed us to help him a bit more. So now at that point, we were not able to reach out to anyone, especially considering my mom was alone and she didn't know the right people to get in touch with.
Now, we're very sorry for your loss as well. The loss you feel today as the next of kin should send out a very strong message for the ones ideating suicide. Understand what the near and dear ones really go through when your close family member takes the plunge. If you could just highlight the kind of loss you're feeling today, because this is a loss that people who are ideating today need to understand that the near and dear ones are really left with when they end their lives.
For us, it was a shock. When I say I feel sudden, because I saw my dad just a couple of days before, say a few weeks before, and to get this feeling that he took his life was a shock, and more so for my mom. It will be a long journey to understand what happened, but really I ask people to be empathetic, to see if somebody around you is struggling, to not just shun it out, but actually understand, give them the right information and ask them to seek help, because you could definitely save a life. My only regret is wish I knew more, wish I knew the right people, wish I had been able to tell my mom more and been able to ask my dad to seek help at the right time. There is a lot of regret, but I hope that people do understand that there is help out there. You can get that and you can save lives, and there are a lot of resources. So please go and get those resources and end this battle of suicide.
Absolutely. You know, we hear your pain, and this is a strong message going out to our viewers as well. This is the kind of loss one is left with. The next of kin is really left with when one ideates or commits suicide. So before taking the final plunge, go ahead and seek help. There are lots of suicide helplines also available. I'm going to ask the producers to flash those numbers across the screens so that it becomes a little more handy for everyone watching the show as well. Stay with us right there, and I appreciate you joining us on the broadcast as well. Dr. Samir Parikh, are you seeing a spike in the number of people crying out for help? And in this COVID crisis, is financial uncertainty and distress playing a humongous role? Would you say there is today, after hearing the case as well, there is a need for a creation of an emergency task force?
Yes, Chaiti. Yes, but I must say that a lot of my empathy and condolences to you, ma'am, and for the fact that you came out and shared your views and thoughts with the world at large. That in itself will save so many lives. And as somebody working in the field, I'm exceptionally grateful for you finding this, this courage to be able to help others. Coming back to our question, Chaiti, let's understand this. What is happening is unprecedented, but we were unprepared. So look at the kind of stresses that we are going through. Remember, in any case, 1 in 5+ people would have mental health issues in their lifetime in any case. 300 million people in the world suffer from depression, even pre-COVID. Suicide is among the top 10 killers in the world pre-COVID. That's a fact. Now you add on job cuts, economy, uncertain future, academic uncertainty, fear of illness, losing near and dear ones, the immense stigma that is there. You put all of that together, it is taking a toll on the mental health. And yes, what WHO worries about the future, are we going to have a crisis on mental health in the future? Yes, possible. Picking up from what the Honorable Minister Nitin Gadkari said, that what is it that we need? We need positivity, we need confidence, but how does that come? That comes when societally we come together, support each other. Because until the support reaches at the ground level to each individual, before institutional supports reach them, we are going to struggle. We run a 24-hour helpline for that matter. We've seen a huge spike in the number of people calling us, and it's so human. And what are these calls about? I'm worried about the future. I'm worried about my finances. I have EMIs to take care of. I have just lost a job. I am worried of losing my job. How will I take care of my family? What happens to my child's education? What happened to my child's career? These are real problems. And these real problems need very immediate solutions, or you give an immediate hope that makes you feel that fine, this is a short-term crisis. Let's wait for 6 months based on various parameters that all of us as a society, government included, have planned, will get us out of it. We need to find a way to show the light of hope to people, and do that now.
You know, I'm aware, Dr. Parikh, your suicide prevention helpline gets a lot of calls and it works. There are many other suicide prevention helpline that work as well, and they're absolutely effective. But there are just so many, Dr. Parikh, that just do not work. Do you see a need for an emergency task force creation coming in from the center with a policy in place? Because so many good people, so much good work is being done at a standalone basis in different parts of the country, but all of it getting funneled together and some sort of systematic intervention at a larger level. Do you see that as a necessity this second? Because we're just in the middle of a pandemic and almost towards the tail end, will be coming out in maybe a couple of months' time.
I think spot on, Chetty. What you are saying is right. We have been focused upon the physical health component, which we should be. We are focusing on beds, ventilators, ICU, awareness. We should be. But we also, it's time to start now looking at the mental health component. We need a task force. Given that a larger chunk of our experts are in private sector, we need public-private partnership. We need government to help ensure that mental health crosses the boundaries and creates an outreach where excess is less. Remember, we have more than 500% shortage of experts in our country. So we need to come up with a task force. It needs to happen now. We need to have a suicide prevention policy. We need to have more and more helplines at local levels in vernaculars, well publicized, that everybody knows that they exist. And we need to ensure that mental health outcome of the pandemic becomes as much a priority for us as a society as much as is physical health and staying safe is.
Absolutely. I'm just going to come to Dr. Jayjit Bhattacharya as well, who's an economist. Dr. Bhattacharya, the government has announced a 20 lakh crore rupees economic stimulus package that many doubt does not address short-term impediments. What, in your opinion, can or should be done to ensure that people feel a sense of financial certainty yet again? Because many psychiatrists and mental health experts that I've been speaking to say there's only this much of help that we can give as psychiatrists. We can counsel, there is cognitive behavioral therapy, there is medications, but then again, when there is no money in your pocket, or if there is some sort of financial debts or home foreclosures or things like that that people are suffering, how much can we go ahead and help?
No, absolutely, Chaiti. In fact, as per Indian scriptures, an immediate short-term benefit and help provided is considered to be far more valuable than a larger amount of help provided sometime in future. And that's enshrined in our scriptures. And I think, therefore, what the government did in the beginning of April of providing 2,000 rupees to many people who are below the poverty line, and especially the women, I think that was helpful at that point in time. But that's clearly is not sufficient as we get into the middle of May and towards the end of May. There is certainly a sense of financial despair from a very large number of people. Now, if you compare with, let's say, even United States, although it's not the right comparison, but they have taken immediate steps to provide almost $2,400 to the most vulnerable section of the society, plus additional $500 per child that they've provided under the CARES Act. And that's significant. Even if I use the PPP conversion level, that's about 50,000 rupees in Indian purchasing power parity terms. And that's significant. Even if you look at Hong Kong, they have provided 10,000 Hong Kong dollars to every family and no questions asked. I think that is what we probably need in an immediate basis. So even if you provide, let's say, 15,000 rupees to, let's say, even 200 million families in this country, which will cover 1 billion people at an average of 5 persons per family, that's something that's quite affordable. It translates to about $40 billion of incentive. And of the $300 billion of stimulus that the government has planned to look at, which is the 20 trillion rupees that you were talking about, it is clearly affordable to keep aside $40 billion for immediately injecting into the economy by providing it in the hands of people. Now, we do have the infrastructure to actually provide that money to people, because we have the Jan Dhan accounts, we have 340 million Jan Dhan accounts created, and clearly the way the government gave money in the beginning of April was quite effective. So why don't we repeat it and we provide a much larger amount of money, at least for the month of May and June? It'll take care of people's expenses, and the sense of financial despair that you're referring to, that gets mitigated.
Because somewhere, Jayjit, also we are noticing that the issue when it comes to liquidity has been taken care of the government, but with the repo rate cuts that are coming in from the RBI as well, that's a different story, that the banks are unable to pass on the repo rate cuts to the end consumer as well. But when it comes to the actual cash and consumer discretionary spends going up, people feeling a sense of financial security, that somewhere still is amiss, isn't it?
Yeah, absolutely right, Chaiti, because this will take a lot of time for the policy steps to convert into liquidity. And there will always be a lag between policy and actual impact on the ground. And that is precisely what I'm referring to, that we can't afford that lag. And therefore, money has to be given directly into the hands of people. We saw 300 million people crawling from the cities out as migrant laborers going back. I don't even know how many of them still have access to their bank accounts, how many have got access to any cash in their hands. What will happen when they go back? Why are they going back? I mean, do they have any certainty that they'll get income once they go back, or they'll get food when they go back to their villages? Because the reason why they migrated was that they had no money left in the villages. Now they're going back. Do we have any financial support for them, or are they looking at a even larger financial despair? So even with all the liquidity easing that has been done by the government, and rightly so, because we need to make sure that the companies also survive. Otherwise, there'll be no jobs left once the coronavirus issue is taken care of. And once people come back to work, they'll realize that there is no companies left to actually work for. So it's important to make sure that the companies survive. But it's also even more important to make sure that people survive right now. And the sense of despair that you have been referring to should not be there. And that injection of money in a timely manner right now will also provide that psychological cushion that somebody is looking after. And that should see them through for the next 2-3 months, by which time possibly the effect of the pandemic will be significantly mitigated, and possibly the economy will start getting back somewhat on.
Hold on to your thought right there, Dr. Bhattacharya. Dr. Samir Malhotra, is there a need of a national suicide prevention policy? Many countries, including China, have been able to significantly reduce suicides after they implemented a suicide prevention policy. The numbers prove that as well. Are you seeing the Mental Health Care Act being implemented as well? Because the Suicide Prevention India Foundation I was speaking to, they said that 94,000 crore rupees is something that is going to be required upfront to implement the act.
Absolutely. Well said, Jayati. It's a very sensitive topic, and it's good that you've brought it to the fore. Mind and body are interlinked, and we cannot separate mind from the body. Whenever we are stuck with any kind of a stressful situation, and this is a pandemic of its kind, there's a way our mind reacts to it. There are people who can be quite vulnerable, and they need immediate support and help at the ground level. So when we talk about policy, yes, there needs to be a policy in place. We have a new Mental Health Care Act 2017, which was passed in 2018, wherein in section 115, they have decriminalized suicide or suicidal attempts. So at the same time, we also have to make sure that we are able to prevent people from reaching that brink where they tend to end their lives or even contemplate ending their lives. It's when you feel socially isolated, when you feel you are not worth it, when you feel there's no hope left in future. Those are the thoughts that run you down and make you take such drastic steps. And what is known as over the last 5 decades, there has been a steady increase, in the suicide rates, and particularly so amongst people between 15 to 40 years of age, which is the most productive and vulnerable age group here. So one has to be very careful in terms of planning policies so that it's not just on paper, it has to be also implemented in spirit and soul so that it reaches at the ground level and is able to support those people in distress.
Right. Dr. Parikh, I'm going to come to you for your closing thoughts. We need some solutions right there. Problems are many, solutions are also many, but the implementations of this solution becomes the need of the hour, especially now because we are seeing this kind of a spike and a wave that is setting in with many cases. And you rightly mentioned earlier on the show as well that your suicide prevention helpline is seeing an influx of many people calling up, which only indicates one thing, that there is a real need for an emergency task force. What would you say? Should there be a minister appointed for mental well-being? What about the implementation of Healthcare Act? Should one introduce a national suicide prevention policy? And should the right kind of money be, put into the economy to be able to implement the Mental Healthcare Act as well? Dr. Samir Parikh, your closing thoughts.
Yeah, I think the fact, the one thing that I pick is let's find a solution right now. And the economic solution needs to people right now. We need to instill hope right now. If we instill hope right now, we are going to be able to mitigate a lot of mental health outcomes that could be very detrimental to our social well-being. Having said that, we also need to immediately make mental health a priority, parallel to physical health a priority, make a task force, make public-private partnerships a reality, use Digital India, do the last mile connectivity, use helplines, use role models. And thank you to you, Chaiti and India Today, to keep talking about mental health, because we need more and more conversations on mental health in media, mainstream media, prioritizing the well-being of the society.
Absolutely. So a larger convergence is the need of the hour, as pointed out by Dr. Samir Parikh, Dr. Samir Malhotra, Dr. Jayjit Bhattacharya, highlighting how financial insecurity and what it's what it can really do when it comes to tackling this issue as well. Financial certainty becomes very important at this point of time, because distress ends up playing a role as well. And I thank you very much to the lady as well who joined us in spreading a very strong message as to the kind of loss the near and dear ones end up feeling when a person who's close to you ends up taking the final plunge. I thank you very much, all of you, for taking time out and joining us. This is Chaiti Narula signing off.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.